With the special meeting, board, you have the agenda in front of you, so I'll entertain a motion that we approve the agenda as it's presented.
I'll make a motion to approve.
Second. All in favor? Thank you. A couple of announcements. One, as you can see, Miss Beck isn't with us this evening. She's unable to attend in person, but she is on the phone. We have her on speaker here, so hopefully, Miss Beck, you can hear us. What's hung up on her? She was on there. Get her back. The other announcement that we have is our regular board meeting, of course, will be August the 23rd at 6 o'clock in here. See if we can get her back first.
Hey, Miss Beck, we lost you, but we got you back.
All right, thanks.
Yes, ma'am.
So at this time, we'll do our public comment section of the meeting. A reminder that public comment is limited to 3 minutes per speaker. We've got the iPad set up here timer-wise, so we'll try to turn that around so each speaker can see that. And we'll ask that you step to the podium in the back because we are live streaming on Facebook, so that way the people on Facebook can hear you and see you as well. So.
We'll say as well, too, you are allowed to remove your mask when you're speaking at the podium, okay? Because it's going to be less than 15 minutes.
Our first public comment is Ms. Kathy Maley.
Hello, my name is Kathy Neely. I reside at 116 Litlock Crest in Hayesville. I'm a retired nurse with a master's in public health. The research is overwhelming. Masks help reduce the spread of COVID-19, especially the Delta variant, which is so contagious. Adults can choose to become vaccinated. Children do not have that choice. We must protect our children. I'm surprised a member of the health department is not here, because we really should be seeking their input and their guidelines in this crisis situation. In this county and in many other counties, masks have become a political statement. Masks are not a political statement. They are a safety issue. We know they help to mitigate this virus, and I strongly encourage all board members to vote in favor of mandatory masks for all people in the schools. Thank you.
Thank you, Ms. Kathy. Next, we have Mr. John Chandler.
Good afternoon, John Chandler, Cherrywood Circle, Hayesville. We have 4 children who are attending or have attended the Clay County school system. We're very, very pleased with the system, and I appreciate the tough choices that the board is faced with. I'm sorry that I didn't write a letter to the editor thanking you, the board, sometime in the last 3 weeks for the decision you made at your prior meeting that I thought kind of touched on everyone's needs. If you want to wear a mask, wear a mask. If you don't want to wear a mask, don't wear a mask. Or if you don't like either of those options, you have a virtual option. I thought you hit the sweet spot on that. I think it's still the sweet spot. With all due respect, the data on masking is inconclusive. It's contradictory at best. And we've been told a lot by the CDC. Get vaccinated, you're going to be fine. Do this, you're going to be fine. Look at Israel, the most vaccinated country in the world, one of the hottest spots in the world with breakthrough vaccines. So I would ask the board to just reaffirm the decision that you made a few weeks ago. It, again, seems to hit the sweet spot and allow parents to do what they want to do and what they feel is best for them. With that said, I don't envy you in your positions. I thank you for the role you're playing, for the service you're providing for the community, and I wish you the best in this decision. And we're going to be we're going to be jackets regardless, but thank you.
Thank you. Next is Mr. Chad Rodriguez.
Hey everybody, thanks again. My name's Chad Rodriguez. I reside here in Hayesville, over in Chinook Village. I've got 3 kids that attend Hayesville Elementary. Their ages are 6, 7, and 9, and have loved everything about school. They went through the whole process this last year of masks and virtuals and the back and forth of people making those decisions. And I much to like what you said, want to applaud that. I think we got through that school year surprisingly well. I know there's a few moments there where people got sick on one hand, but I think overall, compared to everything else that was going on around the world, I think we fared well, right? And I'm super thankful for that, because I think about these are real lives, these are real people. I know people that have lost their life to this sickness, and that is not something that is death on me. And so I guess I wanted to just articulate like a couple things. Was one, looking at the schools that have started. I haven't seen a single school that has started to go back that has seen and made a decision to not enforce masks that hasn't immediately shut down a week later.
Union County isn't.
Well, again, but let's let that roll out. Every other state that has gone back, some of Georgia's largest schools, all of those states, and Mississippi, everybody else has been dealing with immediate shutdowns of the school. I know masks are an inconvenience. I don't like wearing this damn thing. I don't think anybody does. I don't think anyone's gonna raise their hand and be like, ooh, yay, like, I'm super excited about this mask. But that being said, it is helpful. We were able to get through the school year and deal with what we were able to do and have a school year last year because the kids were wearing masks and distancing. Was it an inconvenience for them? Maybe. My kids, whatever. You had a bit of a conversation with them and they're surprisingly mature and were able to deal with it and move on. I think what my fear here, and I know none of us want to disrupt our kids, there's nothing more disruptive than the starting and the stopping of school. As much as a mask is a pain, I don't see how the better option is for us to go 2 weeks into school, have what we're going to have, which is cases break out. Because again, it's foolish for us to think that we're going to be some special case when we see it everywhere else. And have to force the kids to go from back to school, maybe in virtual. That's tough on the parents. It's tough on the teachers. It's tough on all of us. And much like you said, I don't envy the position that you're in. As someone who, for years, I don't know how much time is left, I can't see, but I think there's like a minute left. 13 seconds. Anyways, I just don't envy your decision, but I just want to say that we made it through this last year. As someone who's been a long time person in ministry, degree in theology, I think about my neighbor when I think about why I wear a mask, and it's what I teach my kids. So hope you guys can.
Thank you. Next we have Ms. Wendy Navarez.
I would definitely agree with you that no one likes these, right? They're stuffy and it's hard to breathe, but we do it for each other. So my name is Wendy Navarez. I came to watch, to listen, and to support the board members here. I am running for Congress in this district. I realize that you have a tough decision ahead of you, and that we have to remember at the end of the day, we're here to care for one another and for our community. And at the end of the day, that's what makes us American, because we're united together. We may have differences of opinion, but that's why we're here, to take care of one another. In the interest of full transparency, I do have 3 children at school ages, but they are not here in Clay County. We live in Buncombe. And almost all school boards have went back to mandatory masking. I personally support this just at first due to the science, due to the Delta variant. I understand that it's inconclusive, but I was in the military for 11 years, and you don't go into things without preparing, even if you may not have to deal with the fight, right? So our focus should not be politicizing these masks. It should be about academic recovery. These kids have lost a lot of education in this process. No kid that I know of, no matter how good of a student they were, did well through virtual learning. I mean, they may have pulled off an A or a B, but there were holes in their education and their learning, and we need to make sure that's our focus going forward. If that means that there are masks that have to be worn the first couple weeks, 9 weeks, whatever, I'm assuming that you will not, this won't be the last time you meet in the school year, and that the decision will be revisited. And like we were saying, we would, obviously want all of us to be able to go maskless as soon as possible, as well as our children. So really the goal here is the health of our children, their academic recovery, and to remember, kids are resilient. My 5-year-olds, they were masked all through preschool, all day long, and did not have a problem whatsoever. My high schooler, she wore a mask. I even coached cheerleading this past pandemic school year, and all of my cheerleaders cheered loud and proud for Reynolds High with their masks on. So let's learn something from our own children, that we're resilient, right? And that we can adapt and overcome as things progress, but to be cautious at first. Thank you.
Thank you. That's the end of the public comment section, and I think Mr. Cole's got a little PowerPoint presentation as well. I know it's kind of awkward, but I think his PowerPoint's going to be on the screen behind you, so if you want to turn it, it may be a little bit easier to see that.
Just, first of all, everyone, before I go into the slides, I wanted to read it. We already have released our Clay County Schools health program. Our school nurses put together in concert with the health department. This has not changed. I just wanted to kind of buzz through the highlighted areas, if I could, to just kind of remind everyone of what's in place, because these are the things that are out. It's one of the things that is outside of our control, but it's a very important thing, because it has an impact on how and when students and staff have to be quarantined, and it's directly impacted by mask wearing. So just first of all, on the first page, students, parents, and staff should conduct daily home-based symptom screening prior to coming to school. If anyone in the household is being tested or has tested positive, or if they've been exposed, then they should not be at school. If the student or staff has had close contact, which is defined as being within 6 feet for at least 15 minutes cumulatively during the day in the past 14 days with someone diagnosed with COVID-19, then they should not be at school. If the student staff has any of the following symptoms, they should not be at school. So a fever of 100.4 or higher, sore throat, difficulty breathing, cough, new loss of taste or smell, diarrhea or vomiting, or new onset of a severe headache, especially with fever. If they are diagnosed with COVID-19 based on a test, their symptoms, or does not get a test but has had symptoms, they should not be at school until they meet the criteria below. It's been at least 10 days since the student or staff first had symptoms. It's been at least 24 hours since they had a fever without fever-reducing medicine. And there has been symptom improvement, including cough and shortness of breath. If a student or staff member has had a negative test, they can return to school once there is no fever without the use of fever-reducing medicines, and they have felt well for 24 hours, and they would need to provide a note from their medical provider to the school. A student or staff member can return to school following normal school policies if they receive confirmation of an alternative diagnosis from a healthcare provider, and then provide a note from that doctor that would explain the COVID-19-like symptoms. And once there is no fever without the use of fever-reducing medicines and they felt well for 24 hours. And of course, you can always call the school nurses for questions. Page 2 is a reference guide concerning how we handle positive cases. We're required to follow this. It comes from the Strong Schools North Carolina Public Health Toolkit and North Carolina DHHS. So first of all, isolation is required for all presumptive, symptomatic, or confirmed cases of COVID-19, and the date of release is determined by the Clay County Health Department, not us. Contact tracing is carried out for close contacts. It is required for all positive cases of COVID-19. There's a link there that you can go to that's about 30 pages long that tells you how they go about that process if you're curious. Quarantine is required for any individual who has been a close contact within 6 feet for at least 15 minutes cumulatively over a 24-hour period, starting 2 days prior to symptom onset or the positive test. That's how they determine who has to be quarantined. Now, there are exceptions to that quarantine rule. 1, individuals who are fully vaccinated and do not have symptoms do not need to quarantine after a close contact unless they start to show symptoms, at which point they should be isolated and tested. Proof of vaccination would need to be provided to the school nurse or to the Clay County Health Department to be excluded from quarantine. Second, people who have tested positive for COVID-19 within the past 3 months and recovered and do not have symptoms do not have to quarantine as a close contact. So proof of a positive test within the past 3 months or verification by the health department would be needed for that. Third, students who are not fully vaccinated after a close contact in a classroom setting or other in-school setting, if masks were being worn appropriately and consistently by both the person with COVID-19 and the potentially exposed person, do not need to quarantine. This exception does not apply to teachers, staff, or other adults in the indoor classroom setting. So, obviously, when masks are optional, that is the area that is most impactful of the quarantine protocol. And also, that one does not apply to extracurricular or athletic activities. We can have different rules for those. So, Clay County Schools follows the recommendations of the Clay County Health Department regarding quarantine dates and return dates of students and staff. School nurses are in daily contact with the health department. So just to be clear, once there's a positive test, the health department and the school nurses take over. We don't have any choices in how that process works. Okay, it's out of our hands at that point. And whoever the health department says has to quarantine. And they have to quarantine until the date that they give us. So I just wanted to be clear about that. All right. Now, the board has asked me to just put together some data for them to use in their decision making. So that's what the PowerPoint is about. It is not a recommendation. So just first of all, July 26th, the board decided to make this a parent option. At that time, on July 26th, there were 10 active cases in Clay County. There were none in our students or staff that we were aware of. And Georgia had just begun school with masks by parent option. So that was kind of the situation on July 26th. On August 18th, which is today at 2 o'clock, I got updated data from the health department and our school nurses. We now have 64 active cases in Clay County. And the health department is reporting that they're having a lot of kind of households. So like one person will get positive and before they can quarantine, everybody in the house has got it. And that's really driving up the numbers. We have 2 positive staff. We have 1 quarantine staff. We have 13 positive students and 21 quarantine students. And we have 1 student that was exposed but would be allowed to attend wearing a mask because that student has been vaccinated and falls under that exception. Unless they become symptomatic, and then they would have to isolate. Towns County Elementary closed this week due to positives among staff and students. So after about 2 weeks, Towns County, it was mainly just like it was for us last year. They had so many staff, they had more staff positives that had to quarantine than they had substitutes. And that's the reason why they had to close. And that's why we had to close last year, the times that we did. Also, all of the area hospitals are reportedly filled with no beds available. So that's another fact that was given to me. Next slide is just some more information about the quarantine protocol. the overall goal of the school system, we deal in education. We want to educate our kids. We're not public health experts, although everyone has tried to make me be a public health director. That is not what I am trained to do. So I do take a lot of direction from the health department and our school nurses. The goal is to safely have face-to-face instruction 5 days per week, as close to normal as we possibly can, if not more, because that's what our kids need, especially after all this time. You know, we had a conversation the other day, and believe it or not, our second graders have never had a full year of school. It's crazy to think about. Second graders have never had a full year of school. When we bring everyone back to our school system, we do not have the physical space to be able to distance 6 feet apart if we have school 5 days a week for all of our students. So that impacts our quarantine policies because we don't have enough building space to spread people out. If everyone is masked, no one has to quarantine when there is a positive unless that person becomes symptomatic. That's the quarantine protocol. Optional masking, everyone needs to understand, will likely lead to multiple quarantines among students and staff and create a lot of remote instruction much of the time for the next however long it takes for this to kind of burn through. That shouldn't surprise anyone. That's the way it was last year. And so as the situation changes, we have to make decisions, and whenever we have enough staff that are out quarantined that we don't have subs to replace them, we can't safely have school. So then we have to shut down until we can bring people back. And that's the same situation I think that they had in Towns County. Our current safety precautions that we can put in place really without board approval, these are just kind of our day-to-day procedures that we are putting in place. Due to the current data trends, the need to limit community spread due to overflowing hospitals and the current quarantine protocol that is required, we felt like we needed to do these. Number one, we're disinfecting all of our buildings with sprayers twice per week, so we'll do that on Wednesdays and on the weekends. We're not going to do field trips the first month of school. There's no need to go out and kind of expose our kids to other areas that we don't control. We're going to limit visitors to office areas only during the instructional day, and all visitors must wear a mask when they come in. Principals can make exceptions as they see fit, as long as visitors wear a mask and social distance at least 6 feet at all times. So an example of that is open houses, particularly in our transition students. Like our kindergarten students, the parents really want to be able to walk them through the building and see where things are. So we're just going to do that in small groups, and we're going to do it by appointment, and if everybody wears masks, we're going to make that happen. Our other students really already know the building. Our first and second graders, they really don't need to do a physical open house. They can do a virtual open house. And that's pretty much the same at all of our school buildings. Next is safety protocols for extracurriculars and sports. You'll remember that DHS guidelines give us leeway to do those differently. So what we're doing is the same as the other schools in our conference. Athletes are not being required to wear a mask while actively playing the sport. They will wear a mask while they're on the sidelines after they're given an adequate amount of time to catch their breath, get a swallow of Gatorade. If they're on the bench, we can spread them out for the most part, and then they're going to wear a mask. Coaches can remove masks when they're actively coaching from the sidelines, but if they have to get in the huddle with their team or something like that, they're going to wear their masks. Everyone will have to wear a mask on the activity buses while they travel. Spectators are not required to wear masks. Working staff, so teachers working the gate, working the concession stand, they will be required to wear a mask at all times. But if you're a staff member that is attending the game as a spectator or as a parent, then you're not required to wear a mask, just like everybody else. And then our gyms, we're going to disinfect our gyms after every event, just to try to be on the safe side. Masks on buses. Federal regulations require masks to be worn by everyone on yellow buses. That's not in the control of the local Board of Education. So we're going to have a box of disposable masks on every bus. We're also going to give each of our students, regardless of any decision that is made tonight, we've got 8,000 masks that were left over from last year. We're going to give every kid 5 cloth masks that they can use, no matter their decision. But if they forget their mask, they can get a temporary or a disposable mask when they get on the bus. And then once they get to the school, depending on the decision of the board or which way things go, that'll govern the next step. So, last slide, just the specific to student and staff masking protocol decision. Currently, as of right now, based on the July 26th decision by the board, masks are a parent option. The current quarantine protocol, again, is required by the state. We have no control over that. So whenever we have a positive, the health department gets involved and they make the decisions. Current data trends do show a large jump in COVID spread in the last 3 weeks in Clay County. We've gone from 10 to 64. Optional masking will likely lead to numerous instances of quarantining, remote instruction, and possibly having to shut down schools when we get low on staff and we don't have enough substitutes to cover. But whatever decision is made tonight, whether we stick with what we've got or we change, I can promise you that our staff is ready to handle the logistics and the needs of our students that come as a result of whatever the board chooses to do tonight. We did both of these approaches last year at some point in time. We can carry it out, so no one needs to worry about that. It's really just a matter of the approach that the board decides to take. Thank you.
Thank you, Mr. Cole. So, board, you have heard Mr. Cole's presentation. Obviously, had numerous public comments made. So, I'll entertain any comments or discussion regarding masks, sticking with the decision made back in July or going in a different direction.
Ms. Beck, just to be sure, you're still there?
I am.
All right, good.
Questions?
I think for me, the biggest thing is the whole quarantine. If masks aren't required, here we have to possibly quarantine a whole class. And last year we ran into an issue with some kids being quarantined 3 to 4 times at any given time. And so I think that's a big area for me that I'm concerned about, is we're losing more instruction time for those kids. So it's...
I think, as bad as it may seem to some, and as frustrating as it is, it's been expressed. Wearing masks, I know I wear one in the office all day long, and then if I come here for something, I'm putting one on again, and that's, to me, that's frustrating. And just like everybody else, I deal with those frustrations. But I think if our goal is to overcome the educational gap that's been mentioned from last year with virtual education, I think we know from the data that we've got from our principals that kids really struggle with virtual learning. It's not something, I think Ms. Navarro said it. She said that there were lots of kids who did well, but there were a large majority that did a whole lot worse. And it's not a good thing to be going back and forth. So I think if our goal is to minimize the time out of school and maximize the time that they have in-person instruction in the safest way possible and give them a sound basic education. Unless the North Carolina Department of Health and Human Services changes their quarantine guidelines, which that's what we have to go off of, then I think masking has to be required on the front end. I think we can come back and look at that in 2 weeks, 3 weeks. Obviously, we're going to meet routinely every month, but just as we've seen in the last few weeks with everything changing the way it has been, I don't see any reason why we couldn't get back together more often if the board agreed to do that.
I agree that we need to probably, I agree that masks will help the students be in the classroom and get the most education they can get. We won't have to possibly go down the road that other districts are having with stopping and starting. I think it's a wise decision to start the school, Mr. Chairman, with wearing masks, but I also would like for us to revisit it relatively soon, maybe even before our September monthly meeting.
So is that comment in the form of a motion, or is that just your comment?
I would like to make that a motion.
I'd like to add to it that I would like to see us not have the mask on, but for the safety of our children and our employees, I think that we should wear the mask starting out, and then if we have to, we can change it just as soon as the numbers go down and the threat's away from us.
Ms. Beck, do you have any comments?
Yes, our focus is to keep our kids in school. And with the increased numbers and the volatility of this variant, as well as the unpredictability, I think we need to give serious consideration to the mask. And as it's already been stated, with the intention of revisiting this as the conditions permit.
So we currently have a motion from Mr. Caldwell that we begin the school year with masks, but that we also revisit that, as Ms. Beck has mentioned as well. Our next board meeting is the 23rd. I think obviously that would be way too soon to revisit that. But I think it wouldn't be a bad idea to maybe look at that sometime after the Labor Day holiday. Give us a few weeks there.
The Tuesday after Labor Day is September 7th, if that's what you're looking at.
May I ask a clarifying for the minutes? Are you wanting to mandate masks for students and staff, or just students? I should ask, clarify.
Mr. Caldwell.
My motion is for both.
Both.
Both indoor and outdoor, just indoor?
Well, my concern is indoor.
So we've had that motion, we've had discussion. Any other comments or a second?
Can I ask a question?
We don't answer questions on it. You have public comment and then we meet.
So is there a second from anybody?
I'll give it a second.
Mr. Jones, second. All in favor? Thank you. So, do we want to also make a motion that we meet that Tuesday, September 7th to revisit this? Or do we need to go beyond that?
I would like to make a motion to revisit on that Tuesday.
Tuesday, September 7th. So we have a motion to revisit this topic Tuesday, September the 7th. Is there a second? Mr. Jones, second. All in favor?
Aye.
Thank you.
Now, I do have one more question, because this brings this up. The board has elected to provide a virtual option to our parents that request it. We did that at the same time on the 26th when masks were a parent option. And we currently have 44 requests for remote instruction. So would the board like to keep allowing a remote option? You're not required to legally, it's really up to the board. If we're gonna ask everyone to wear masks, I mean, we could say we're not gonna provide a remote option, everybody needs to come to school. But that is up to the board, we can do either one.
I would like some discussion on that, if that's okay.
Okay, Ms. Beck, do you have a comment that you want to go ahead and make?
Well, I am concerned about the cost of virtual per student, and you know, if we know the cost, and I think that would give us a little bit more information about how we could what we should consider?
The cost of it differs depending on the age of the student, but in general, you're looking at somewhere from $1,500 to $2,000 a year to educate a student through a remote option. It's more expensive for high school students. High school students gets up towards $3,000, but in K-8, you're looking at somewhere between $1,500 to $2,000 a year, which we do have federal programs money to pay for that. That is what the ESSER funds were given to us for. So we can afford to pay for it. It's really just a matter of, I mean, our data shows that about 85% of our kids just do not perform very well in a fully remote environment. And so now again, we can give parents that option. We give them that information, we give them the facts, and then they make a choice. But that's what the data shows us from last year. And so it's just a matter of, do we provide that parent option even though we're requiring masks, or do we want to take that option away and require them to come to school? And these numbers, the 44 requests may go down now that masks are going to be required. I mean, that's possible too. So that's the number of requests we had effective 3 o'clock this afternoon, which the 18th today was the last day that parents could make that request. So that's where we are.
So we would need to do this on an annual basis if we're going to do that. If we're going to do the virtual, we don't have an option of just saying we'll do it first semester.
No, we could do it first semester. Obviously, with high school students, their classes would be over at the end of first semester. But
right.
We could move kids from remote into classrooms at the beginning of second semester. That would be a much more orderly move than bouncing back and forth. That's not good for anybody.
That's very logical. Another thing that I'm just reflecting now on Dr. Shook's comment in an email to us that this would be based on their being able to prove that they had some sort of medical reason for requesting it. Is that a possibility?
We would always, if a parent had a legitimate medical note from a doctor, those are exemptions. Those exemptions are in place. What it would do if we remove this remote option, it would remove the ability for a parent to just say, I'm afraid my kid is going to contract COVID by going to school, so I want a remote option.
Right.
Because everyone is wearing masks, we could just say we don't provide a remote option unless you have a medical exemption. And fear of COVID, when everyone is wearing masks, is that's not a legitimate medical exemption according to current policy.
May I just for from a special education standpoint?
Yes.
Please. That cost is not cover special education, and we still not have a member to offer virtual special education. I just want to make that statement. So, and I do know that the principals have expressed that several students have requested to have the virtual option, have requested that, so that can be added.
That is true. Several of the 44 requests are exceptional children. We haven't really gotten a legal answer yet on whether we can use federal ESSER funds to pay for EC services. So if the lawyers say that we can't, then it would be more expensive to provide EC services in a virtual environment out of our EC budget than normal. So we just haven't gotten an answer to that one yet.
And Mr. Cole, do you mind to repeat the cost of that again, please? I know it's
For like K-8, it's somewhere between $1,500 to $2,000 for a year. For high school, it can get up to $3,000. But depending on the classes that they take and that sort of thing. But
somewhere with 44 students right now.
As of today at 3 o'clock, it was 44 students.
And that's at $3,000 for all 44 it costs.
That would be the max that it would cost. But we could pay for all of that, except for EC services right now. We could pay for pretty much all of that out of ESSER funds, need be.
How long will it be before we find out about the EC?
That I don't know. Soon, I hope.
And you said a significant amount of those 44 is REC students?
Not a significant
Okay.
amount, but some of them. I think it was probably 5 of them, 3 to 5 of them.
We didn't request that day budget.
And I mean, even then, when you're talking about EC students, it depends on the services that they need. Some are more expensive than others, so that doesn't really, I'm not sure of the range. So just as a reminder, do we want to leave a parent option for remote instruction, or do we want to remove that option? Currently, as things are, with no motion, we would leave the remote instruction option in place by parent choice.
Mr. Chairman, I personally want to leave the option in place right now. That's my opinion.
He wants to leave it as an option.
So is that, are you making that?
I didn't think-
motion?
I didn't-
He doesn't need to make a motion, that's what we have.
Give me my opinion, Mr.
Yeah.
Chairman.
Jones?
I'm sorry, I'm having difficulty hearing.
So Mr. Caldwell has stated that he would like to leave the parent option as we decided at last month's meeting for remote
Yeah.
remote instruction.
Yes, I think we should, perhaps look at this, and make it definitely for the semester rather than the entire year. Is that gonna, we need to make another motion for that, if we not?
We would need a motion if we wanted to have it only for this first semester. And make that as a minimum, and then revisit that.
Exactly.
As we near the end of the semester to decide on the spring semester.
Right. That would be my motion.
So, if I understand, Ms. Beck, you're making a motion that we have a parent option for remote instruction for the first semester only, and revisit that prior to the start of the spring semester.
That would be my motion, yeah.
Okay. So we have that motion. Is there any other discussion or a second of that?
I'll second that.
Mr. Caldwell seconds that. All in favor?
Aye.
Very good. There's no other business, and I'll entertain a motion that we adjourn. Mr. Caldwell. Jones second. All in favor? Thank you. Thank you, everyone. Appreciate your time.
Thank you, Ms. Beck.
Yes, thank you.
Have a good evening.